So Cynthia's asking, what actions and steps does Kaweah put into place to ensure patients who come in for surgery don't get COVID?
So the first thing I mentioned is that we test every single patient. So 48 to 72 hours before their procedure, we do the PCR molecular test to determine if they have the virus or not. If they have the virus, we cancel the procedure and we reschedule it to a time when they're COVID-free. So that's the first thing we do to protect primarily, the staff and other patients that are in the hospital. But we also, we are constantly disinfecting. We also, if we have a patient that tests negative for the virus, but we're concerned that they could possibly still be at risk, we have a dedicated operating room that is just for those potential risks where we take care of those patients there. Again, though, through the constant disinfecting, our staff, obviously we're trying to make certain that none of our staff are COVID positive. If any of our staff do exhibit symptoms or test positive, they're removed from the hospital, they're sent home to quarantine. So we make certain that the staff that are taking care of our patients are in fact COVID-free. They also exercise tremendous universal precautions. They use all of the personal protective equipment, the gloves, gowns, face shields, masks, again, doing everything to protect the patient from a possible exposure. There will always be risk. I have to be honest and say there's no absolute guarantee that that you wouldn't potentially be exposed. But I can tell you that I think the hospital is probably one of the safest places you could be right now. Just the way we just work in such a sanitary way, just the careful protocols and precautions we follow. I would be very comfortable myself having surgery here.
Okay.